Ladies and gentlemen, dear colleagues, that's the title of the topic. Bloodlet out cupping therapy is a highly biological clinical procedure. Modern medicine should benefit its biological talents to improve the outcomes of medical therapy. Definition of cupping therapy. It's withdrawal of blood trapped within the tissues in the interstitial space together with the inflammatory mediators which are believed to be functionally obliged to this blood via skin scratching and suction for the purpose of cure and prophylaxis. The term functionally obliged signifies that these acidic mediators are obliged to this trapped blood to keep it in liquid state whatever it stays within the tissues. Exactly similar to citrates in blood donation bags. The term are believed means that there is no single reference to support this obligatory relation between the trapped blood and these mediators except the behavior of blood itself during the process of blood let out. As it never clots inside the body, whatever long it stays, but it clots fast and strong when it's let out. So long it does not lack the ability to clot, why it does not clot inside the body? Similar to blood of muscle trauma, which clots, thrombose, and organize. That's due to the acidic inflammatory mediators which are obliged to it. That's exactly similar to the osmotic obligation of fluids and electrolytes to glucose being lost with it in urine during hyperglycemia. Cupping therapy in brief steps. Cupping starts by placing skin suction cups to localize the sites of therapy and to attract the undesired elements toward the skin. Cups removed for skin scratching, then reapplied with repeated suction and removal of blood. The procedure reaches no blood let out whatever the suction is. This indicates that blood is let out in cupping therapy from within the tissues, from a closed limited space, not from an open circulation, even tiny capillaries. Otherwise, blood let out will not stop so long suction goes on. With repeated suction and removal of blood, the procedure reaches no blood let out whatever the suction is. Waiting hours or a night, revision of suction without further scratching reveals blood out again. What is the source of this new blood? No source of blood except the circulation, meaning that the circulation is sacrificing some of its elements. Why? Because undesired. It is all old RBCs. What is that new blood? It constitutes the blood which would trap within the tissues and supposed to be let out in the future cupping procedure. That's exactly seroclearance, which is clearance of the circulation from its undesired blood, all the blood elements. Seroclearance constitutes breath and nutrition for cells and tissues. It occurs the few hours after the cupping procedures. The figure shows an MR view of a thigh hematoma at 12 inches from the skin. Hematoma attracted toward the skin in oblong shape after skin cupping suction. Hematoma rather vanished after skin scratching and repeat suction. The figures show the tiny skin scratching and the sufficient blood let out from these tiny scratches. The figures show a cup filled with blood and a strong clot standing unsupported on the skin. The figures show the cupping procedure reaching a step of no blood let out in spite of continued suction. The figures demonstrate seroclearance, showing the digital color view of venous blood samples from a hepatitis C patient before and after cupping therapy. A fundamental factor in cupping therapy is the source of blood in cupping therapy. Blood is derived out from within the tissues, not from the circulation, even tiny microcapillaries. The definite criteria as concerns the source of blood in cupping therapy. Blood letting out reaches a point where blood let out stops whatever the suction goes on, meaning that it's derived from a limited closed space, not from an open circulation, even tiny microcapillaries. Or else, blood wouldn't stop so long the suction goes on. And this is a good document. Cleaning cups from blood and revision of suction reveals every time blood which is darker in color and faster in clotting, as if the blood is existing in layers. Blood could exist in layers within the tissues, not the circulation. And this is a quite logic clinical document. Elderly people on anticoagulants for cerebral or cardiac reasons have not to interrupt these medications for fear of bleeding when they undergo cupping for therapeutic reasons, such as sprung back or joint sprains. As these drugs run and function inside the circulation, while blood in cupping therapy is derived from outside the circulation. Therefore, there should be no relation, and that's what exactly happens. Blood is let out and clots faster and stronger than any venous blood in around 5 minutes, as if these anticoagulants are not there. This should be a strong document. The blood which is let out in cupping therapy clots faster and stronger than any other blood, as it is not freshly leaving the circulation, but left the circulation earlier and got trapped within the tissues. This strongly clotted blood, if left, dissolves again, as it does not include the components of a stable clot, which are RBCs, platelets, and fibrin, but it's made only of old red cells. The figures show strong clots starting to dissolve. Microscopic findings confirm that blood which is let out during cupping therapy and the clots are made only of old red blood cells. This means that blood which is let out in cupping therapy could never be from the circulation, even tiny microcapillaries. Otherwise, it should be a mixture of blood elements. And this is an absolute document. Hence, the blood which is let out during cupping therapy is definitely from within the tissues. So it is functionless as the blood functions inside the circulation. Thus, what's the purpose of leaving blood to trap or accumulate within the tissues so long its normal existence is inside the circulation? No purpose except to remove it, and no way to remove it except scratching and suction as being diffuse within the tissues. Accordingly, cupping therapy should include no harm, as the lost blood is useless. Cupping is mandatory even for a healthy individual, as any normal individual would include trapped blood within his tissues, particularly the upper back, as part of the normal human physiology of seroclearance. The benefit of cupping is definite due to withdrawal of unhealthy elements from the body. The source of blood in cupping therapy is an integral fundamental fact, constant in all cupping procedures. Whoever thinks to deconstruct the biological building of cupping therapy should devalidate this fact first. Biological benefits of cupping in very brief: encouragement of local, general, and capillary circulation, seroclearance, elimination of the toxic inflammatory mediators, elimination of any existing microcapillary compromise or sclerosis. Consequently, guarding against vascular accidents via elimination of unnecessary hemoconcentration. Protection against complications of diabetes in the heart and the leg. Guarding against chronic illness and cancer. Augmentation of individual immunity due to seroclearance. All these benefits are due to histamine release, nitric oxide liberation, and seroclearance. The figures show the inflammatory mediators as clear fluid on top of a clot inside a cup and as clear fluid drops near end of a cupping procedure. Mechanism of function in cupping therapy. Seroclearance in cupping therapy is achieved via pooling of the circulation in concomitant with microcapillary dilatation due to histamine release and nitric oxide liberation. Withdrawal of inflammatory mediators due to seroclearance. elimination of microcapillary compromise due to withdrawal of inflammatory mediators. Therefore, the mechanism of function in cupping therapy to achieve its biological benefits is based mainly on integral simple regions, histamine release and nitric oxide liberation. That's the basis of the scientific theory in cupping therapy. The scientific theory in cupping therapy, the highly selective pooling of the whole circulation within a localized sector of the capillary bed over a limited interval. The localized sector of capillary bed is related to the area of the cups. The limited interval is related to the lifetime of nitric oxide, which is 1 to 2 hours following the cupping procedure. The scientific theory in cupping therapy simply is highly selective pooling of the whole circulation within a localized sector of the capillary bed over a limited interval. The scientific theory in cupping therapy is imaginary, hypothetical, but valid. So please follow the moving slideshow illustration. The healthy biconcave red cells and the unhealthy spherical cell. The side view of a healthy and an unhealthy red cell. The flow of healthy red cells within the microcapillaries. The unhealthy spherical cells have to get squeezed in order to pass through the narrow microcapillaries and regain its spherical shape in wider vessels. That's the imaginary illustration of the microcapillary arteriovenous junction in normal situation and during the microcapillary dilatation. The smooth flow of healthy red cells through the dilated microcapillaries. That's how the unhealthy cells fall out of the circulation. And that's how the unhealthy spherical cells could get stuck at the dilated microcapillary junction and fall out of the circulation. Interesting. And that's how seroclearance occurs. Seroclearance, withdrawal of inflammatory mediators, elimination of microcapillary compromise are all integral biology for the human body that could never be achieved via any clinical or scientific measure except cupping therapy. The Nobel Prize Award in 1968 has been given to the statement by Morishita. The microcapillary compromise due to accumulation of inflammatory mediators is the main hidden reason behind major chronic illness and cancer. Thus, modern medicine should employ these biological talents of cupping therapy to improve the outcomes of medical therapy. Hopefully that everybody now not only understand why blood let-out cupping therapy is a highly biological clinical procedure, but would also love cupping therapy as a gift from the nature to the biology of the human body integrity. Malheureusement, no chance to discuss how cupping therapy is fundamental, integral, not empirical. And the interesting subject of the natural physiological instincts in the behavior of blood during cupping therapy. The upper back is the area of the body capable and entitled to accommodate the unhealthy blood element expelled from the circulation via the slow human physiology of seroclearance. Hence, the upper back is the essential area of the body for cupping therapy and prophylaxis, and that the interstitial space is the intelligent yard where blood let-out cupping therapy exerts its biological talents. Blood let-out cupping therapy is a highly biological clinical procedure. Modern medicine should benefit its biological talents to improve the outcomes of medical therapy. And thank you very much.